Well, she's an amazing lady who's a major success story in getting healthy and making a change. Good for her. Now, for more on my interview with Patty, visit our website at drsteveshow.com. You know, Patty did great with her bariatric surgery, but the question is, would it be right for you? Well, joining me now from St. Peter's University Hospital is Dr. Vincent Iannace, who's performed thousands of weight loss procedures. Dr. Iannace, thanks for coming in.
Thank you for having me.
All right, so let's talk about this bypass surgery, because there's different types, and it really isn't a one-size-fits-all thing, is it?
Yeah, that's the nice thing about what we can offer today. In the past, we were restricted to a few operations. Now there are 3 major operations that we can offer patients: the gastric banding, the laparoscopic vertical sleeve gastrectomy, and the gastric bypass.
All right, so let's start with the gastric sleeve. Who might be a candidate for the gastric sleeve surgery?
The gastric sleeve operation is an operation where we change the shape of your stomach from a football shape to a banana shape, and that ultimately helps you feel full eating less. The people who are the best candidates for this operation are people who tend to require certain medications that may be contraindicated in either the lap band or the gastric bypass.
Right, so it would be a perfect fit for that type of person. Now, the other procedure, pretty common that most people know about, is the lap band procedure, or the gastric band. Tell me about that procedure. Who would be a candidate for that?
The lap band operation is an operation where we place a belt basically around the top part of the stomach that creates a small pouch, and then also helps you feel full with less food. It's adjustable according to the patient's needs. The patient who's best indicated for that procedure tends to be patients who are bulk eaters.
Right, so they like to eat a large amount of food, but the thing about it is you're not actually removing any part of the stomach at all. It's just kind of like you said, causing a little tightening at the top, right?
That's right. We don't rearrange your anatomy. You are basically having an assistance to help you feel full, eating less.
All right, the risks and complications of this procedure?
The lap band is actually the safest bariatric procedure we offer, and the risks are generally not associated with the surgery itself. It's usually generally associated with nutrition afterward. Okay,
I want to get to the last one, is gastric bypass. Probably the most popular of all the bariatric surgeries, the one that Patty Austin had. Who would be a candidate for that surgery?
Well, I believe the gastric bypass is the gold standard procedure for its weight loss success as well as its resolution of metabolic derangements. The best candidates could be anyone who is considering weight loss surgery or surgery for weight loss. However, in particular, if you're a sweet eater, it may assist you in your weight loss history or weight loss future, because it may make it uncomfortable to eat those foods.
Right, but and you get a lot of bang for your buck with that surgery, right? Early up front, you lose a lot of weight generally?
That's right. So you get the earliest weight loss, it's the quickest weight loss, and you have the earliest resolution of your comorbidities, especially diabetes. If you walk into the hospital with diabetes, 12 hours after the operation, your diabetes may go into remission if we catch it soon enough.
All right, Dr. Iannace, thanks so much for coming in. And the good news, folks, a lot of this stuff is covered by your insurance. We'll be right back.
Hot flashes, bloating, lack of sex drive, mood swings. Oh, the joys of menopause. Up next, we'll take a look at a treatment that may be the cure to help you feel better.
This portion of Dr. Steve is brought to you by St. Peter's University Hospital, New Brunswick, New Jersey.